This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
We can start off with our first program. LSU, PM&R, take it away.
All right, I'm gonna share my screen real quick. All right. So my name's Lauren Cooper. I'm one of the PGY3s at LSU. And first, we want to thank the PM&R Scholars for inviting us back to be a part of your virtual residency fair. This is a really great opportunity for all the applicants now that things have turned to the virtual applications. So we hope that we can answer a lot of the questions that you have about our program, and we hope that this will motivate you to apply, and we hope to see some of you in the fall. So I'm joined today by a few other residents. We've got Elise Cleveland, who's a PGY4 resident and our chief resident this year. We've got Evan Reuter, who's another PGY3, and Mason Kay and Zach Poche, who are both interns with us. Since we are a categorical program, we get to involve the interns starting 1 month in. And I think we're also joined by our PD tonight, Dr. Patrick Owens. So we will go through the PowerPoint, and we will be monitoring the chat box for questions along the way, and we will answer those throughout the presentation and then at the end as well. So just as a quick overview, we all know the different aspects of PM&R, and I think the program at LSU does a really good job of incorporating all of these different aspects into our training. In particular, the pain medicine is one that draws people to our program, since we do have a fellowship in New Orleans. And because of that, we get really great exposure to the interventional pain procedures starting early in our training. But despite that, we also get great experience in all of these other areas as well. And also throughout the presentation, we included some fun pictures just of New Orleans and Louisiana and our residency program, so that way it feels like you visited us. And of course, we can't talk about New Orleans without including a picture of the French Quarter. This is what most people think of when they think of New Orleans. It's got the typical architecture, the fun, like Bourbon Street, and then the great cuisine, beignets, gumbo, jambalaya. I could go on, but I'll stop there. And we've got some more pictures as well, so you can see that New Orleans is not just the French Quarter.
All right. Yeah, hi, I'm Elise Cleveland. I'm a PGY4. I'm the chief resident here at LSU. Happy to be here again this year. So just going to kind of run through requirements. I think these are pretty across the board for most programs, but just in case, you're wondering. So recent photo, your CV, 3 letters of recommendation is usually the minimum. You can always get more if you want. Dean's letter, your official medical school transcript, board scores, which are still in play, I believe. I think it's like another cycle before step 1, the applicants won't have step 1 count. Or it will just be pass fail. So just to give you an idea, previous interns average step 1 scores around like 237, and COMLEX scores are generally above 500. and then your personal statement as well. So, and like Dr. Cooper said, we are a categorical program, so we accept 6 interns for the PGY1 position every year. And yeah, it's right around the corner. Another beautiful picture of New Orleans. So I'm originally from Montana, and then I did med school in Chicago, and I made my way down here, and I love being away from the snow and the cold. And there are, while we have all like the city and like kind of fun restaurants and everything, there's also a lot of good green spaces in the city as well. So I've done like a few half marathons since I've been down here, and like City Park is where I did the last one. So it's a huge park. There's like a golf course on it. There's mini golf. There's farmers markets, tons, soccer stadium, baseball stadiums, like tons of stuff. So, yeah. So a little bit more about our program. So as I said, we're categorical. We're also very proud about our procedure numbers. We get our interns started like day 1 with procedures, which is really great. So by the time you're a PGY4, you're feeling really comfortable and you're training and teaching the PGY2s and 3s some of these procedures. We are required to do scholarly activities. I feel like there is research opportunities. We're not a super heavy research program, but there definitely are attendings that do some research that you can get involved with. Lots of case studies that our residents do. And then also lots of like writing chapters, book chapters, questions, stuff like that. We have 5 days of educational leave on top of your vacation and sick time as well. So it is supported to attend conferences, and occasionally we'll be able to get some funding for these depending. And we are kind of known for being like pain heavy, which we kind of default into that. You get a lot of pain rotations. However, if you don't or want to do pain, it's very easy to request changes and get to do rotations in areas that you're interested in. So definitely, consider us if you're interested in pain, and if you're not interested in pain, that you're not set in having to do those. We have lots of opportunities in all the areas. All our rotations are in New Orleans. There's about one that's probably our longest commute, about like 40-minute drive. The rest are all, if you live in the city, like 10, 15 minutes. So it's really nice not commuting really far every day. And we have didactics on Friday afternoons, and then we have a monthly EMG lecture as well. And here it's just a picture last year of a few of our residents at didactics. Look, they're all so engaged in learning.
Hey guys, my name is Zach Poche. I'm one of the interns over here at LSU, and I was in your shoes last year, coming to these same virtual seminars as well. And I understand where y'all are at, and I was interested in pain coming into this. So procedures and getting procedural experience was really important to me. And I mean, as I kind of went through the interview process, to me, it was very clear that LSU just had by far the best procedure numbers. I mean, and they say right here, you compare just the ACGME requirements compared with the LSU averages. And quite honestly, too, if you're interested in doing procedures and you take initiative and you want to do them, you're going to get much higher than these averages too, as well for LSU. There's ample opportunity. I mean, even right now, I've had the very, very fortunate experience of starting off on an interventional pain rotation as an intern. And it's been so much fun because I've already logged 24 procedures. I've been able to do some SI joint injections, some facet joint injections, lots and lots of trigger points. So I've already I've already met my ACGME minimums for some of these, for the axial facet injections. And to say that I can do that as a first month intern is a really, really cool experience as well. For some of our procedures, we do both at the VA and some private hospitals. So you will see some lower volume where it's nice and slow and you can learn, as well as some higher volume where you can really get some practice in, some repetition, and log some higher numbers as well. In fact, it's just kind of a test to how strong we are with our procedures. I'm working right now with one PGY4 and a couple of the pain fellows that we have over here, but two of which did not train at LSU. Actually, the PGY4 at LSU has actually been training some of the pain fellows because he's so good and so strong with procedures. And one thing else I just wanted to cover as well with ultrasound, because I know for me, I really wanted to find a program that was strong with ultrasound. We actually have an ultrasound curriculum over here at this program. We're doing 4 sessions per year on like a rolling basis, covering knee, shoulder, elbow, wrist and hand, as well as the foot and ankle. It's taught by a sports medicine trained physician who actually trained at the Andrews Institute, and is going to teach us about proper scanning, technique, anatomy, and just general injection skills as well. So it's a rolling basis, so you'll complete the curriculum a few times by the time you get to PGY 4 year. So by the time you're at that point, you'll be very proficient with ultrasound. And in fact, we even have a practical exam where you'll be assigned one of those joints and have to prove you're proficient with ultrasound. So you will get both experience within the sports, musculoskeletal side of it, and the interventional pain side of it. And this is Dr. Cooper and Dr. Cleveland, who you've had the pleasure of meeting tonight. And of course, we can't talk about Louisiana and LSU without covering my personal favorite, crawfish. It's more of a springtime delicacy that we have over here. In fact, our residents, we do a resident retreat every spring as well. We do a big old crawfish boil. And if you happen to come to New Orleans around springtime, around Mardi Gras, please reach out and I will tell you the best places to get crawfish in town. And one of my co-interns, Mason, is going to talk about the correct general outline for you. Or if Mason's not here, I can go ahead and take it. So yeah, just to kind of give you a just general idea of what we do, year one is definitely very PM&R heavy. We're very fortunate to have this experience. For example, we do some pediatric rehab with a mix of sports. You can do 2 to 3 months of interventional pain. So you get lots of hands-on experience with procedures early on. We do a couple months of rheumatology, which has some really good overlap with PM&R. You do 1 month of family medicine wards, which is very good working with the family med residents. We do 2 months of internal medicine outpatient with a nice little mix of specialties like vascular surgery, cardiovascular. So you get to some cardiology, podiatry, multidisciplinary pain, musculoskeletal radiology, which is very useful, and palliative. And I think Mason's here. He can talk a little bit more about that.
I think he's having some microphone trouble, so you did a great job though, Zach. And this is just a picture of our current intern class.
And my name is Evan Reuter. I am one of the 3rd years that is in Dr. Cooper's class. And I'm to talk us through what we do in years 2 through 4. So the nice thing, So the nice thing about our program is that when you're in your 2nd year, you kind of start, even in your 1st year, you start doing PM&R rotations. So as a 2nd year, you do a lot of Toro inpatient, but you're also doing outpatient. And what I love about our program is that you're doing inpatient and outpatient, kind of swapping those throughout the months. So as you're getting better, you feel like you're getting better both from the inpatient side and on the outpatient side. And then we also start doing EMGs as a 2nd year. So that means that you have plenty of time to start reading, and EMGs are one of those things where you kind of have to do it and read it at the same time, and kind of do it and then read it and then read some and then do some more. So it's nice that it's spread out and alternated. We have a phenomenal general PM&R clinic at the VA, where it's very much a resident run clinic, and you're basically able to do what you think is appropriate. We have attendings that we have to check out to, but it's very much the resident is in charge of the patient care. And it's really neat where you kind of get your footing and figure out next steps and figure out when it's appropriate to get imaging and when it's appropriate to do procedures. And then on top of that, we do some simple peripheral procedures in that clinic. And as our ultrasound curriculum is improving and kind of ramping up, we're going to start being able to do some more things in that clinic, I believe. So I think that the future is bright and that clinic can only get better, and it's already really phenomenal. As everyone has already talked about, we have a ton of interventional pain experience. We have some good sports medicine, and we really have good pediatric rehab experience if you want that. It's definitely not the bulk of the program, but if you do want to go into peds, I wouldn't say it's something that we're lacking in. It's just not the emphasis of our program. This is a picture of our current residency. This is us, and I believe all the new interns. Yeah, so all the new interns are in this. We have our phenomenal new coordinator, who's kind of new. She's more like back. And then we have our phenomenal program director, who's really making the program better and better every year, it seems, every month. I love living in New Orleans. I am not from New Orleans. I'm from Florida, so I'm used to the swamp. But I absolutely adore living in New Orleans. I live kind of in the heart of the city. I could actually walk to a few of our sites. So I'm walking distance from the VA, which is where we have that resident run clinic I was talking about. And then I'm walking distance from University Medical Center, which is where we have some inpatient consults, and we do those EMGs I was talking about. I absolutely love Mardi Gras. Mardi Gras is a great time. It is family friendly, unlike many people think. Once again, I'm walking distance a block from Mardi Gras. Festival season tends to be in the spring. I think I went to a festival every single weekend, March, April, and May. So, I mean, it's hard to be bored. And then there's amazing food. You're drivable from a beach. I went to a lake this past weekend, pretty close by, and there's just a lot to do. And then sports also. I'm not the biggest sports fanatic, but I went to a Pelicans game, and where else can you park for free and walk to a professional NBA game? So I was able to park on the street for no charge and just walk to an NBA game. It was really nice. Maybe that was when the Pelicans weren't doing so well, but
5-minute warning.
and then this is one of those beautiful Mardi Gras parades that the floats are really stellar, and that's what I mean by it's family friendly. I mean, it's just like people throwing you toys. So it's really a good time, and everyone is having a party. I mean, everyone's just in a great mood, and the floats are beautiful.
All right, well, that kind of wraps up our formal presentation. I've listed all of our email addresses here, as well as that of our program coordinator, Maggie. If you have any questions throughout the application process, we are all available to answer those questions for you. I've also included our Instagram. If you would like to follow us on Instagram, we post a lot of pictures of our fun resident social events and some clinical stuff too. So we will now answer any questions. I see there's some chats, so let me stop sharing my screen and then we can do some questions. And then the question I'm seeing, I'm guessing this is asking about like advanced positions, which we do not have any starting PGY2 positions. It's only our categorical that start the PGY 1 year, 6 spots.
There's another question about IMGs, international grad applicants. We do interview international grads, so we don't like automatically toss your application out or anything like that. but I don't know. I can't say, at least since I've been a resident here, all the residents have been from the US. So hopefully that answers that question. But it doesn't mean we're not, open to interviewing those applicants. There's a question about sports coverage. So this is actually growing for us too. We have a couple rotations with sports medicine docs and sideline coverage. And we've actually just started this month. I was the first one to rotate with a couple other sports medicine docs, and they do a ton of sports coverage for a lot of teams, college teams in the area, Tulane and Loyola and UNO. So it is growing, and we are getting more and more of those opportunities. So if it's something that I think you won't be like required to attend the sideline coverage, but if you're interested and you're gonna like show up and go to it, the opportunity is available for you.
And I just want to chime in. There was another question about other fellowships that people go to. So I think that when you graduate our program, you're ready to practice. So something, even though we're very pain heavy and there's definitely an emphasis on it, when you graduate our program, you can be a general PM&R doc and be very proficient in a lot of procedures.
Yeah, and we have residents who do PEDS fellowship, sports, spine, pain, spinal cord injury. So we've had residents do kind of all the fellowships, probably except for palliative care. I don't think we've had anyone do that one, but.
And then the cost of living in New Orleans, I would say it's a cheap city, but like everywhere, it's probably getting a little more expensive. But you can definitely get by. There's delicious food that's pretty cheap, and you can find cheap housing if you really want to. It just depends where you want to live.
Awesome. Thank you guys so much for your presentation. I think we're wrapping up on time. I'm sure if you guys have more questions that these guys would be more than welcome to answer them. Yeah, thank you guys.
Thank y'all.